Recovery girl? I got my license. I know, you sent me a text telling me about it. Yeah, I also told my dad, grandpa, and aunt. They were sad that they couldn't celebrate it since we can't leave without permission. I'm sure they're proud. I'm glad that you passed. But now you have to focus on your healing test. Right, there's only 2 days left before the exam. After this, I can finally heal people. Yes, let's start our classes now. You have a lot to learn. After classes. Hey recovery girl, I was planning on calling my dad for something. Oh, what for? I wanted to ask about dad's healing quirk. And how it works so I could apply it to my healing quirk. Ike, do you know? I do, but don't worry, I'm alright. I'll see you tomorrow, recovery girl. You left the infirmary. So you told them about it, Tatsuaki. You were walking back to the dorms. Hello YN, how are you doing? Good, I just finished my classes with recovery girl. Your test for your healing license is right around the corner, right? I guess recovery girl told you? Yes, do you need anything? Yes, can you tell me about the healers in our family? I see, you want to know how their quirks work so that you can apply it to yours. Right? As expected, you already know everything. I could give you descriptions of their quirks. Yeah, grandma had a healing quirk. Can you tell me about it? Sure. Your grandma's healing quirk could heal someone when she sings. Depending on the duration of her song, she can heal simple injuries or heavy injuries. I see, I don't think I can implicate it into my healing quirk. Your uncle Riku also has a healing quirk. He can heal any diseases with his blood, it's like medicine. With his blood? Maybe I could apply it. I can just call it an ultimate move. Your uncle Ren has a healing quirk that can take someone's injury or disease. His body is able to heal or break down the disease over time. Should I ask him about that? No, he won't tell me. Was that useful information, YN? Yeah, it inspired me to make some special moves for my healing quirk. If you need anything else, don't hesitate to tell me. Thank you, Dad. You end your call. Maybe I could use my X-ray ability to diagnose the injury or disease. I could also make my blood heal someone without having to be there. Size. What now? Whoa, what's with the long face, Ike? Oh, it's nothing, just worrying if I could pass my provisional healing license. Oh, recovery girl found a way to let you take it? Yeah, it's in 2 days. You should just relax, you passed the provisional, I'm sure you can pass this one too. It's hard to do that since I have to take a written test too. Wait, you do? It makes sense since they must know some medical stuff, right? Yeah, so I have to study for courses I would normally know in my second year. Man, that's tough, but I'm sure you'll find a way. Thanks, I should probably rest early. Good night Ike, rest well. Thanks, you too. The day of my provisional healer license exam arrived. Your test was during a school day, so you were allowed to skip classes. Are you ready, Ike? Yeah, I think. Good luck on your test, Ike. I'm kinda jealous you get to skip classes. You think taking a test is better than going to classes? You got a point. Don't worry, I'm sure you'll do great. Ida, don't be nervous or you won't be able to focus. Todoroki, that's just going to make them even more nervous. Thanks for the encouragement. Maybe I should go over what I learned. But what if my quirk is not enough? No, I can't use my real quirk to pass or I'll have to explain. Ike, how about we go over some subjects that we learned? Oh, sure. Which word is defined as the study of the function of living organisms and their parts? Physiology. Correct. Maslow's hierarchy of needs was developed for what purpose? To enable the PCT in understanding a patient's placement on the wellness/illness continuum. He believed that an individual's behavior is formed by the attempt to meet essential human needs. Correct. There are 3 levels of health promotion with corresponding actions. Which level of care can reduce further loss of function? Tertiary prevention. Correct. A nurse in the emergency department is engaging in an initial assessment of a patient. Which assessment takes priority? The airway clearance. And why's that? Because a clear airway is essential for life, therefore, has priority. Can you tell me the ABCs of assessment? The ABCs of what? What are they talking about? Present Mike and Midnight were listening to your conversation while driving. The ABCs of assessment are airway, breathing, and circulation. Correct? You see, you know all of this to heart. I guess I do. Why are we in a hospital? We were given permission to take the test here. Ike? Huh? Sarah, what are you doing here? I was chosen as one of the judges. I see, so you'll be the one who'll score me? Not quite, there are more judges who will score you. I'm glad to see you're in good health, child. Hello Dr. Hideo, and I'm alright, thank you. Honestly, you scared me when I heard you were kidnapped. Akihiko was also worried sick about you. I'm sorry for worrying you all. Come on, they're safe. That's all that matters now, and they have a test to take. Recovery girl, I'm glad to see you're in good health. Minato, I'm glad you're also doing well. I hope UA isn't working you too hard. After all, with your age. Ahem, I assume this child is the one who will take the test. Yes, this is my apprentice, YN Ike. I have talked about them a few times. A few times is an underestimate. It's a pleasure. I am Dr. Minato. And I am Dr. Aoto. It's nice to finally meet Tatsuaki's child. You know about my dad? Who doesn't know about Tatsuaki? Good point. I was an apprentice for Natori Ike. Wait, you're my grandma's student. Yes, I guess your dad never told you about me. No, this is the first I heard of it. That's enough chit-chat. Let's begin the test. Sorry Ike, but don't expect me to give you a good score because you were my intern. I would have been insulted if you did. You will take the written test first. We don't expect you to get a perfect score since you're still a first year. The practical will be worth 50% of your overall score. You just need to get a score above 70 and you'll pass. That's 20 more points than in the provisional exam. Then again, that's because they have a written part. You'll have 2 hours to finish your written exam. Dr. Aoto hands you your test and you enter a room. I guess I'll be taking my test here. You sit down. Your test begins now. You look at the questions. Are fibrous membranes and fibrous connective tissues the same thing? No, they're not the same thing. Fibrous membranes are thin tissue layers that cover some organs and body cavities of the human body. Fibrous connective tissue provides support and strength because of its collagen fiber components. A nurse instructs a patient to color code the hot water faucets and dials. What might be the possible age group of the patient? Older adults are instructed to color code the hot water faucets and dials to prevent burns and scalds. There is a fire in a hospital. Which is the priority? Action of the nurse? Rescuing patients in immediate danger. To assess for internal injury in the peritoneum of a patient who has sustained blunt abdominal injuries in a fall, the most effective diagnostic test is a computed tomography, CT, scan. The law requires 2 heroes to accompany a healer. It also requires an agency to meet a certain security standard. Why was this law made? The law was made to prevent a healer from dying after the incident with the healer Yato. Yato was killed after being kidnapped from his agency, which caused immense backlash due to the lack of security. After 2 hours. Time is up, please pass your exam to me. You hand over your exam. Your next test is the practical. You will heal a set of patients who volunteered to be healed by you. There will be 3 rounds of patients with injuries and diseases from mild to severe. These patients were chosen depending on the type of healing quirk you have. I see, so not all healers take the same practical test. It's to see if they're able to excel in their area of healing. The first 3 patients will have mild injuries. The next 3 patients will have severe injuries but were provided first aid. The last 3 patients will have some kind of disease that varies from mild to severe. Will my points be deducted if I can't heal the disease fully? No, we just want to see if their condition will improve. We don't expect you to fully heal them. Oh, okay then. You will start with patients with mild injuries. We'll watch you through a one-way screen. You will also be given the patient's reason they're in the hospital. However, we won't tell you about their injuries or diseases they may have. You will have to write down the type of injury and disease they have after treating them. I understand. So it's like writing a normal report. After Sarah left, you started to check your first patient. Hello, I'm going to be the one who will heal you. Hello. Do you feel any pain anywhere? You check his document. He was playing soccer when he got into an accident. My ankle just hurts. The patient has a sprained ankle. You healed the patient. Alright, you're healed. Thank you. You went to the next patient and checked their document. She hit her head on a door. Do you feel any dizziness? No, but my head hurts a lot. You cleaned up the blood and healed her afterwards. Looks like she didn't sustain any brain damage. Just a small injury to her forehead. How do you feel now? I feel better. I don't feel any pain. Glad to hear that. You went to your last patient. You check through the patient's document. His arm was bitten by a dog, but the dog didn't have rabies. That's good. Please excuse me. You started to clean up the wound and then healed the patient. The patient sustained lacerations due to the bite. So much for having patients with mild injuries. You're healed now. Do you feel any pain? No, thank you so much. No problem. Dr. Aoto walks in the room. The first round is completed. The next round will begin soon. The patients started to leave, but they thanked you before they left. Aiki, please hand me your report of each patient. You hand your reports to him. These next patients will have severe injuries. If you can no longer heal, just say, I finished. Will this immediately cause me to fail my test? Depending if you did well in the written, you could pass. But many points will be deducted from your score. I understand. I will heal all of them. The second set of patients were brought in. Alright, you may begin. Dr. Aoto left the room. Hello, I will be healing you all today. You went to your first patient and you checked her document. Her hand was crushed due to an accident. You check on her injuries and healed her. How do you feel? Any pain? No, I feel much better. She sustained broken bones in her fingers. You went to your next patient and checked the document. She spilled hot water on her arm by accident. You check her burns and then heal her. She sustained third-degree burns. Did you burn yourself anywhere else? No, just my arm. Thank you so much. No problem. You went to your last patient and looked through the document. He got into a construction accident which forced him to amputate his leg. You don't need to heal me if it's too much, child. I understand that my leg can't be saved. This will take a large amount of my energy. And I still have one more round to go. No? I already said I will heal everyone. How stupid. Why did I agree to volunteer? Not even recovery girl could regenerate my leg. Do not worry, I will heal you. But before I heal you, have you been exercising? Yes, I have. That's good, then you'll be able to walk soon. You begin to heal him. It can't be. His leg starts to regenerate. Almost done. You fully regenerate his leg. There, you're all healed. My leg. The other two patients were shocked while the man started to cry. Thank you so much. I didn't expect you'll be able to regenerate a leg. Dr. Aoto, here are the reports. Dr. Aoto takes the reports. If you're tired, you can end the test here. I'm fine, bring the next set of patients. Such determination. Very well then, bring the last set of patients. The patients started to leave but someone stayed behind. Child, can you please tell me your name? My name is YN Aiki. Aiki, thank you. I lost hope that I would be able to walk again. And I couldn't work because I didn't have the money to buy prosthetics. But you saved me, thank you so much. It's alright, sir. I'm just doing my job as a healer. After the last patient left, the next set of patients entered. You put on a surgical mask. Hello, I will be healing you. You went to your next patient and checked their document. He got sick after eating some dairy products. You check the patient's condition. He looks tired and he's coughing. Excuse me, how do you feel? I have a headache. Have you eaten anything? No, I haven't eaten much today. You healed him. How do you feel? Do you still have a headache? No, I feel better. The patient had brucellosis due to eating contaminated dairy. It's best if you wear a mask to prevent getting any infections here. Oh, okay. You went to your next patient and you checked their document. He was brought in by a family member due to their excessive drinking. Huh? Liver disease? I thought I was supposed to figure out their disease? Maybe they want to see if I could cure such a disease. You healed the patient. There, how do you feel? My stomach pain is gone. I advise you to stop drinking, or your treatment would be meaningless. Your family brought you here to heal you. Don't waste your second chance. Okay, thank you. Man, that took a lot of energy, but I still have one more patient. You went to your last patient and checked their document. Patient has lung cancer. Do they really want me to cure such a disease? Was that why they told me that I could stop the test? Don't worry, sweetie, you don't have to heal me. I'm sorry, ma'am, but I can't allow that. You begin to heal her. It's difficult to heal diseases and I might faint after I heal her, but you finished healing her. Exhales. How do you feel, ma'am? Any pain? My chest pain is gone. And I can breathe better. I'm glad to see you're okay now. The middle-aged woman started to tear up. Then she hugged you. Thank you so much. You hugged the woman back. I thought I wouldn't be able to live much longer. The exam is officially over. We'll have doctors do one last checkup before you're discharged. Ike, you will wait in the waiting room while we tally your scores. Am I going to get my license today? Yes, after we tally your score, we will see if you pass. I'm so tired. Well done, you did wonderful. Did I? Indeed, you never cease to surprise me. They didn't expect me to complete all 3 rounds, right? So, you noticed that was a part of the test. We're back with the results? Sarah, keep your voice down. We're still in the hospital. We have scored your written test and practical exam. And you passed with a 96% score. I passed. Congratulations, Ike. You worked hard for this. I can finally fulfill my promise. After the performance you did in the practical, we would be fools to allow such a talented healer to fail. You didn't expect me to complete all 3 rounds, right? Or rather not expect me to be able to heal such injuries and diseases. You're correct. We expected you to stop your test after the 3rd patient in the 2nd round. Indeed, most healers pass out after the 2nd round. If the healer can pass the 2nd round, then they'll pass the practical. However, you exceeded our expectations when you completed all of them. Hey, I already knew Ike would be able to do it. With this license, you will be able to heal people. However, keep in mind that you will be responsible with people's lives. And you should also value your life. Don't give it up just because you're a healer. Dr. Hideo hands you your healer license. I really did it. I'm so proud of my intern. Sarah hugs you. Keep your head up, you will be a beacon of hope for many people. And the patients' families also expressed their gratitude to you. This feeling, I didn't think it would feel so nice. Thank you for your words. You bowed to them. Stay safe out there, young one. Can't wait to brag to Akihiko, he wanted to come along so bad. You two are always so weird. You're just jealous that I have a sibling. After seeing your relationship, I think I'm grateful that I don't have one. Hey, settle down you two, you're acting like children. Even now, you all haven't changed much. Excuse me, Dr. Aoto. Yes? Do you need something? Can you tell me a bit about my grandmother? She was a stern and strict woman, and won't hesitate to point out any flaw I did when I healed someone. However, behind that sternness was a gentle and kind woman. She wasn't always like that, she only became like that after the death of Yato. She taught me harshly to prevent the same thing from happening to me. Why did Yato die? No one had explained why. Even now, no one knows the reason why he was killed. He couldn't save someone and a victim's family member killed him for that. They killed him out of grief? Yes, they blamed him for their family member's death. Ike, the car is here, it's time to go. Thank you for answering my questions, Dr. Aoto. Of course, stay safe on your way back. I'm so tired. I could use a coffee. How did your exam go? I passed? I honestly doubted myself, but I managed. Now where did all that energy come from? I told you Ike will pass, midnight. What? You were the one doubting they would pass. Wait, I should tell my dad, grandpa, and auntie about this, and Midoriya and All Might. And I should also tell Ida that now I can settle down Ike, at least give yourself some rest before you go healing again. You used immense energy healing today. I guess you're right, but now I can fulfill my promise. You entered the dorms but the lights were off. Did everyone go to sleep? I guess it's a bit late now. The lights turn back on. Congratulations? Huh? Congrats on getting your healer license? When did you guys plan all of this? After I got your text, I told the others and we decided to throw you a party to celebrate. It's great to have a healer in our class. Yet, you're the only one who can heal this idiot when he goes dumb. Oh come on. How did this turn into insulting me? I baked a cake to celebrate? Hurry up, Ike. Let's dig in. You just want to eat the cake. Hey Kakure. Guilty. I knew you were going to pass, Ike. Congratulations on getting your healing license. Thanks, you guys. We all are very proud to see your accomplishment. You worked hard. Nods. It was kinda weird not having you in class. Yet, especially during training. I guess we got used to you always healing us that it was weird when you weren't there. I guess I'll be going back as you guys' healer.